All right, so when you hear the word concussion, what's the first thing you think of? The brain, right? An injury to the brain. But what if I told you that for so many people, those lingering symptoms, the headaches, the dizziness, that awful brain fog, what if they're not actually coming from where we think they are? Today, we're going to dive into a really fascinating question. Are those symptoms a brain problem, or could they be a strain problem?
Yeah, anyone who's been through a concussion or knows someone who has knows this list all too well. These things can stick around for weeks, even months, and trying to figure out the real cause can feel like a total medical mystery. And it's a super important mystery to solve because, how you treat the problem depends entirely on what's causing it in the first place.
So let's line up our two main suspects in this case. In one corner, you've got the classic brain injury, the idea that the brain tissue itself took a hit and is struggling to recover. And in the other corner, we have a less obvious suspect, a strain, a whiplash-style injury to the neck and your body's balance systems that happens in the exact same moment as the impact. Let's dig into each one.
Okay, first up, the usual suspect. This is the one we've all learned about, the one that gets all the attention.
The official term for this is a physiologic concussion. That sounds complicated, but really, think of it like this. The impact creates a kind of energy crisis at a cellular level inside the brain. It's a functional problem, a disruption in how the brain is working.
And this, of course, leads to that all-too-familiar list of symptoms. The headache, the dizziness, the fatigue, and definitely the cognitive stuff, like brain fog and having a hard time concentrating. For decades, these have been seen as the telltale signs of a direct hit to the brain.
But now, let's turn our attention to our second suspect, the one that for a long time has kind of been flying under the radar. Let's talk about the strain.
So researchers call this a cervical and vestibular injury. Cervical is just the medical term for your neck, and vestibular refers to the balance system in your inner ear. This injury is caused by the exact same whiplash forces that cause the concussion, that sudden whip-like motion that strains all the sensitive stuff in your neck.
Now here's where things get really interesting. Let's look at the symptoms of this next strain. You've got headache, dizziness, poor concentration, poor memory. Hold on a second. Sound familiar? They're almost a carbon copy of the brain injury symptoms. And that is what makes this whole thing so hard to figure out based on symptoms alone. It's a brilliant disguise.
So if you have two suspects that leave the exact same set of clues, how on earth do you crack the case? Well, a team of researchers led by a Dr. John Leddy decided they were going to try. They launched a full-blown investigation to see if they could finally tell these two injuries apart.
To do this, they looked at 128 patients. And these weren't just any patients. These were people whose concussion symptoms just wouldn't go away, lasting for more than 3 weeks. They were the perfect group to help get to the bottom of what was really going on.
So here was the game plan. First, they had every single patient fill out a super detailed symptom checklist. Next, based on physical exams, they carefully sorted each patient into either the brain injury group or the strain injury group. And then came the most important part. They threw some powerful statistical tools at the data, hunting for any kind of pattern in the symptoms that could tell the two groups apart.
Now, going in, the researchers had a pretty strong hunch. They thought, for sure, the smoking gun would be the cognitive symptoms. Things like difficulty concentrating or feeling foggy. And that makes total sense, right? I mean, surely those symptoms have to be coming from the brain.
So they had their suspects, their clues, their hypothesis. They ran the analysis, fully expecting to find that clean, clear pattern they were looking for. But, well, the results were not what anyone expected.
Yeah, the data just didn't back them up. In fact, it pretty much turned everything we thought we knew completely on its head.
And here is the evidence. Take a look at this chart from the study. Each one of those dots is a patient. Now, if the symptoms were a good clue, you'd expect to see two nice, neat clusters, one for the brain group and one for the strain group. But as you can see, it's a total jumble. They're all mixed together. There is absolutely no pattern to be found.
And this right here is the study's jaw-dropping conclusion. They're basically saying that no matter how they sliced and diced the data, nothing about the symptoms people reported could reliably tell the difference between a direct brain injury and a neck strain. The symptoms are, for all intents and purposes, identical.
So what does this all mean? It means that a symptom checklist, which has been the main tool for so long, just isn't enough to solve the case. And that, right there, has huge, huge implications for how we diagnose and treat these injuries.
And that leads to the million-dollar question, doesn't it?
If you can't trust the very symptoms the patient is describing to tell you what's wrong, then what can you trust? What are doctors supposed to do now?
Well, the study actually gives us a very clear roadmap. To get the real diagnosis, you have to go beyond the checklist. Doctors have to do a hands-on physical exam of the neck, they need to run specific tests on the balance and eye movement systems, and they have to use things like exercise testing to see how the body really responds.
And getting that diagnosis right is absolutely critical. Why? Because the treatments for these two things can be polar opposites. For years, a brain injury meant strict rest. Go lie down in a dark room. But a neck or balance injury? That's often treated with active physical therapy and getting moving again. Think about it. Giving the wrong advice could actually make things worse and slow down recovery.
So if there is one thing you take away from all of this, let it be this. When it comes to stubborn post-concussion symptoms, the symptoms themselves tell you that something is wrong, but they absolutely do not tell you what or where that problem is.
And that leaves us with this final, really powerful question to think about. For decades, we've been focusing almost entirely on the brain. Now that we're realizing the huge role the neck plays in all of this, could we be on the verge of completely changing how we understand and treat head injuries? It seems like the answer isn't just in our heads anymore. It might just be in our necks, too.